I know I'm speaking to a lot of people with a lot of passion around new fatherhood and parenthood, and I've probably been in around the peripheries of this for a long time, and a lot of their thoughts and their in their off time, even when they're not working, has probably been thinking about how we bring up our children, and that the right back to the beginnings of when we became fathers is where I became most interested, and it kind of echoes our approach at DadPad. We've been very fortunate over the last 10 or so years to have had the ability to focus really by working across all different agencies across the UK and now into lovely Scotland, which I had the pleasure of visiting recently and launching in North Highlands and Argyll and Bute. And as I drove up and looking around, I thought I could have just literally stayed for the rest of my life and been quite happy. But what I want to talk about today, and we'll talk about a bit of the origins of where DadPad came from to see how it fits with where you are and how you work up in Scotland, and potentially just handing over later on to Susan to talk about how we can embellish or embed the DadPad and that approach that you've already taken a right aim at, which is to get fathers and partners included as early as possible in that perinatal period, knowing that it's so important and why it's so important. So I'm going to take you back through a little bit of history, and I'll talk about the impact and where I found the issues really lay, and where I thought that the services didn't really put any spotlight on this. This was back in 2005. So my previous life before then, from my psychology degree into the probation service for 15 years, and I'd worked with a lot of men, and mostly trying to nudge their thinking around their beliefs, values, and attitudes, and talked a lot about how they became fathers and the trauma they experienced and what their ambitions to be in a partnership with someone, a loving partnership, would have been had they not dealt with a lot of the demons that they had. By the time they saw me, there'd already been an offence or there'd been addictions, etc. So there's lots of behaviour risk taking or otherwise that had happened during their lives before they got to the point they committed the offence. But I work with these men and full in the knowledge as someone who's now approached, I say approached, yeah, I've hit 50. Looking back, I do think a lot in life is my main goal would be to good father and partner, and a lot of my life that surrounds me is just stuff, and I think these men realized that I worked with. But what we didn't have at that time, at 2005, when I was about to become a father, I didn't have access to much information outside of going to in my own personal circumstances, maybe my father, but unfortunately he passed away. And to be fair, he would say, even if he was here, there wouldn't be much words of wisdom he would pass on, because he was quite an absent father due to the way his work patterns were. It's a common thing. So I went to look around to see if I could find some advice and guidance from nearest and dearest, or just basically out in the community. Found myself standing in mother care, looking around, found a Haynes manual for dads, or, well, not much of a section really for dads. I tried to look online, I tried to look in different places. And at this time, I've been working probation for a few years, and the whole team and I had really focused on not prevention, but we were putting on, we were managing risk with these men and managing future relationships. But what we really needed to understand was, how could we prevent and build men and families from the start? And this was at the time I was walking into to fatherhood, looking around for all this information, and I couldn't really find it. So I, like other dads that I've spoken to since, not knowingly suffering at that time, but I was clearly quite confused that how was I going to be prepared? Like most dads, I had seen the line in the window that the baby was the pregnancy was real, and I had started with that excitement and that happiness and that joy, and then all those little bits of information that we needed to kind of understand and know started to come towards me. And as I'll show you when I put my presentation on in a minute, it kind of started the clock really on walking towards the birth and beyond for me as a new parent, but also started the rushes in of all the things that I would need to do, have to know, ways to be and act around my wife, that I was no preparation for and no support with at the time. And this is the real true sense of the beginning of your kind of journey and learning. I'll try and chart that for you with a few examples as we go through. But for those who don't know DadPad, and I'm sure a lot of you do, you obviously, at the moment, we started with an original guide book, which is wipeable. And I'd sat around a table back in 2009, 10, 11. I'd written some programs for new fathers based on my work with probation and based on work with Webster Stratton around play and praise, the kind of forefathers of bonding and attachment stuff that was going on at the time. And I was getting men coming to these groups slightly too late. They were being handed to me by children's centre managers, who were in 22 of those in Cornwall, running these groups for men. And the mums were reporting that the men at home needed help because they were angry, they didn't know what to do with the baby, they were effectively, in quotation marks, useless. And I had to do a mixture of things around showing them how to bond and attach, and at the same time look at their own levels of managing their mental health and their behaviour at the same time. And this pointed straight back to me like a slap in the face, really, that it is it's before then that we need to be speaking to the men and getting them more prepared and more aware and bringing them into the light. They were pretty invisible, it seemed, until that point. And what I have advocated for since is that every step along those perinatal period, that perinatal journey, is where we should be embedding a way of integrating, talking to, listening to these men. And the DadPad was born for that very reason, something to allow a health professional to show them pictures of themselves and to talk to each other about what it could be like when the door is shut, your baby's home, there's no one else there, and then going, what do I do? What do I do? What do I do to mum or a mother-in-law or wider family? They can get on and do the things that are going to cause the most wonderful kind of attachment opportunities for them and their baby. So I sat around this room to represent fathers on a board in Cornwall, and this was back in 2010 and 11. And they were the midwives, the health visitors, the safeguarding board, the mental health service was there that worked with parents, and the adult mental health service, and public health. And they were all talking about their experiences of working with men as new dads, and what they did and what they didn't do. What they did was not a lot. They didn't really have time within their structures to see them, talk to them. And so we created on the back of that this as a CIC. And we started testing it. 2,000 packs went out. We had next day they started to come back in, the feedback started to come in. Social workers are phoning up saying, working with a young dad, he's suddenly animated, he's suddenly really empowered, he's telling us how to change the baby on the floor so he doesn't fall off the sofa. He's doing things that they never expected to be done. And that was the wake up kind of light bulb moment, that there's lots of hints and tips in, but it's a way of empowering the person to be welcomed into working with services, take an active role the mum can see during the pregnancy, and the partner as a partner that they're getting involved in doing. And it makes them feel more approachable, because services can then start to look after them. So I'm going to turn on my presentation. I'm not going to bore you with loads of screens, but I'm just going to pick out a few salient points that I wanted to make that chart that journey, really, so that we can get up to speed. Slideshow. So hopefully you can still see me somewhere. Lovely.
Yeah, mate.
And I'm just going to move on. So what we called Essential Guide for New Dads, a bit of a fatherhood at your fingertips. Now, a specific approach. We're trying to make it the learning that we had when we did our focus group, because we've co-produced. Dads need a very particular approach, and it's for all the reasons that the pregnancy journey, the countdown between 9 and 0, is different to mums, but both culturally in the past and all the way through service provision to them, and the information that they're going to get from services, mostly through mum still. we've got to understand that it's going to be for different reasons, different purposes. It's why there is a difference, and they need to have it in one place. From what I have experienced, the men need to have a bespoke approach, just as a partner would, and just as a mum would, as we're all individuals bringing our own approaches to parenthood, and they need care and attention. And unapologetically, we want to make sure that all dads and all partners have the right information that they need for their journey, just as mum needs for hers. And then there'll be a coming together and shared understanding when they can talk properly about it all the way through the pregnancy and beyond. That's what we need to get to in terms of prevention. Then able to discuss this in a way that's objective, that a way that makes them more equal in terms of partnership, in terms of their either following a lead is acceptable or joining forces to make decisions, because that's what we're going to set up to role model for lifelong for our children. And the earlier we do that, the less stress that there is, the lower the cortisol effect, and the less stress that baby who looks up into those parents and copies what they do, the less they're going to experience. So I'm already describing a bit of a melting pot, pressure pot here. Trying to forward here, what's going on? So apart from that excitement that I talked about, there's that feeling of overwhelm and feeling left out that can happen. And I'll describe how that can happen for men in a minute. And what we try to do is give them a pad and the app to make sure that their building block approach of building some skills alongside a building a block approach of every kind of antenatal scanner and antenatal scanner assistance, which are a new thing. They could be a great key. If you can find those and they can just talk to the dad, because 99% of dads will turn to a scan. Start to welcome them, start to get them to see pictures of themselves being involved as early as possible. Healthy pregnancy appointments, midwifery appointment, health visiting appointments, any kind of time they walk into a children's centre. In Wales, it'd be a Flying Start, it could be a family hub or children's centre, that they are seen and heard and listened to. How do you change a culture? Well, this is what I'm postulating, is this is how we do it. We work together on the ground to make sure what we know is right is happening, whether it be in North Highlands and or in Cornwall here. Unfortunately, we've just heard we're not going to be getting our new maternity hospital. So again, it's about the services pulling together to do what they can to make sure that individual circumstances, dads won't be able to go and sit in if we have COVID again here, because the rooms won't be big enough, too much viral load. So it's about understanding that is going to affect what happens when the baby gets home and the mum and dad's preparedness for baby. So the watchword is prevention, and going back upstream, right to source, right to where prevention can occur. And that's the clicking clock. We've got all the evidence in the world. So between 2010 onwards, just like Scott, who I've known for the last few years, always trying to track and find where the evidence is. And there's so much that's been produced over the years. There's initiatives that were brilliant back in 2007 that were very much focused like I'm focused, just disappeared into the ether. I've watched things come and go. I've watched systems change, and we've watched new money being poured into by government to certain initiatives, only for it to go within 3.5 years and the staff to churn. So we really need to build a web of knowledge that persists through all that kind of change. And DadPad, we've just kept our head down and got the resources going and out there to make sure that those dads do have something in their hands. And I'm just so happy that people like North Highlands and I are going to be commissioning. We are in over 40 plus areas, nearly 50 in the whole of the UK. So we're nearly over 2/3 in the country will be served by DadPad and DadPad app and co-parent pad, which I'll mention at some point. And it is, as the Fatherhood Institute brought out, the All Institute which does is supposed to bring out the information from all over the world to talk about this as a really important part of it. And the golden opportunity moment was coined really, that men do know that they need to change, to possibly change. Again, just knowing that, but thinking they can't do it can be a real trigger for certain behaviours. This is why they need real kind of support during these periods. And there is, as we've demonstrated, probably a massive lack of support nationally, globally, for men during this -9 months to 2 in terms of getting the real support that they need. So here we are trying to alert each other to the issues of what happens from -9 months. And yeah, I'll go back one, sorry. And so when I was talking about the clock starting, it's a bit of a starting gun. It's -9 months to sometimes if you've a neonatal baby before then. And it's when you have all those light bulb moments that a new behavior having to happen for yourself. You need to change some habit. You're hit with the first things around where do I share news? Should I be sharing the news? You've got to have that discussion. You start to, as the facts come in about how you need to be healthy, you start to change diet or you try certain things. Habits need to change. Your day makeup isn't the same. Mums, as the pregnancy goes on, are tired at different times of day or night. That's going to have an effect. All these changes that are different for men, and men like some stability and rigidity. And certainly we're trying to move as a nation towards being more flexible and adaptable because things happening so fast we need to be. Doesn't mean it's an easy process. We've not been witness to our parents doing that, making a lot of changes, and they're always advocate for stability, but actually there's a lot of changes and lots of flexibility that need to happen, and we need to kind of grow families that can do that so that the children have a chance of doing the same. The just conditions that mum have, whether it be from one end, it could be tocophobia, it could be the fear of having the baby itself. Probably why a lot of the information that mums get during the antenatal period, research shows they don't remember the post-birth again. So that leaves that postnatal period being so important, where men could play a much more fuller part, a more steadying ship, and with knowledge, if we could give it to them. Because the research shows mum can't remember because they're on the focus to zero. And so those changes for her, you could have cravings 1 minute, mixed with indigestion. If you're having cravings for one thing that gives you that indigestion, you've got both things going on. The mood swings, which are real. There's lots of things that are happening, and the men need to know how to talk about that to their partner with kindness and compassion, and for themselves to understand why. If we know a why, we can move towards that behavior. If we don't know, then we're just left to our own default settings or just what we've picked up to do. And some of that can be okay, but some of it can be quite damaging to either the relationship or other aspects of their own mental health, or separate altogether as a couple. We also experience changes, hormonal changes, lowering of testosterone. Sometimes you can get sympathy, morning sickness. You can get all kinds of things. Oxytocin increases. Then you're letting the secret out, telling people about it. But really, when you go to the scan and you see your baby, and those few days when you might be thinking deeply around, oh, I wonder what they're going to look like, what we're going to call them, are they going to get bullied at school, are we going to sleep again? Those kinds of thoughts can lurk in, but deeper than that, they're probably thinking about this is for life. This is how are they going to live? Accommodation. How are we going to make sure they've got accommodation? Jobs. What jobs are secure? Particularly now, we're told a lot around certain jobs not going to be here in the future. We all know that job, potentially, forgive me, job. What do you call it when you're at college? Job advice is pretty useless. Or it has been traditionally, and it persists quite. It's been quite bad. Underlying them, they might think about their own social circle, who they're going to hang around with. If you're on your pregnancy journey, you have to have good health. You have to have an ability to problem solve. You might be thinking about finances. So all these can filter in quite quickly to a guy just sticking their head back in the sand, panicking, over worrying, and possibly just clamping up, keeping their head down and not getting engaged, which, as we've talked about, can be quite very difficult. for the relationship and the baby that's on the way. But essentially, he's worrying about those things that Maslow would talk about, those hierarchy of needs. There's just basic things that they need and they want to protect and provide. Whether rightly or wrongly, that's what we've been taught at the minute. So in order to have honest conversations about that, we need to talk to them a lot earlier during the perinatal period. And worryingly, there isn't that support out yet. Now, the good thing about the DadPad in terms of engagement and in terms of the app, where there are the community groups, that now the local teams can talk to the dads in real time. They can ask them questions about what's going on, and they can start to consider what your local dads need in terms of provision. So we can really get to grips with some of these issues. You know, if men are talking about they're worried about finances and they're worried about this or not, you can forward them, you can get caseworkers in, or you can consider how we can do that, how we can build a service that allows that specifically in a sensitive way that helps them understand when and where they need to think about those things, and how to prioritize thinking about when the baby's on the way. All that is going to do is really help him have more stability and look back on this period with more stability and not build up issues for later on. If he's not talking about it, if he's keeping it all in, then that boiling pot of anger can just flow out during the first few days, weeks, months, year into that family, and that baby will be there seeing that. So visually, this is very, very simple. It's just talking about pressure and pregnancy. Now, this line will never just be this, but you know, from 9 months down to as long as the pregnancy takes, what I'm asserting is the pressure points will just keep coming in, and the pressure will increase over time unless we do something about it. This could be, if you were zooming in on an arrow like this, it could be ups and downs all the way along, depending on what he's gathering in terms of information, or worried thoughts that he has, or pre-existing conditions that flare up, or past trauma that catches up, or worries about the future, or something happens to his health during this situation. It's all going to have an effect, and we could have many different types of lines here. But my main assertion is that the pressure goes up, even though traditionally it's quite hidden because the men have just been keeping it to themselves. And that's why we advocate for a journey built locally, with services that are there, and understanding what those dads were going to need, and trying to build provision around that so that they can support that baby and that mum and them together as a family, as a united family. And local teams can have local conversations in real time to open up and discuss these things. And that'll give you that upstream preventative provision, helping dads cope with what I've talked about and highlighted really, right here in the Highlands and Argyll and Bute. Just to embed how that they can do that with what we have. So we want to assert that you've got the skills and the information given by the pads and the app and the videos and the instruction, a place for them to talk and interact with other dads and professionals, a place to write down notes to get them to ask questions and get answers from people, to gain that confidence. And every time you're seeing them as a health professional, you have a support opportunity to upskill them, to talk about a certain theme or issue, make them all feel more involved and focused, to become the active co-parent. Just to get them to understand at birth what their role might be. I mean, just being there, how do you just try and remain calm if you're worried about so much in the future? But if we've already talked to them during the pregnancy about, you know, you're going to have people by your side, helping them find a social circle that's got a lot of green flags. And by that, I mean, you know, those who are going to be the ones who are consistent with you and deal in realist expectations that help you communicate any worries that you have, let them out, talk about them, and talk back with the mum, just so that they've got a place to go, not ones that pull them away, that heap all the pressure still on the mum post-birth, because ultimately that will come back to bite the dad in terms of, no, he will know he wasn't there to support, and he'll have wanted to, but it is up to us as a system and us as a nation really to start and turn that conversation towards getting dads to talk about what's going on, what their issues are, and how we can help address them as early as possible. The earlier we can get them to help, just like the earlier you get mums, if it's a pre or postnatal mental health issue, for example, the earlier you get them to help, the easier it is to solve. The less human cost there is, less economic cost there is, but the human cost is the thing. The baby's not enduring that as much, and it's the same for dads. So this is why we developed the DadPad, in order to open up this conversation, and we want to build those dads from the start. We mentioned at the beginning about a lot of organisations that no doubt Susan and her team and all teams across Highlands and Argyll will know are out there that are doing things around parenting. In the UK, I've just come back from the Midlands for a 1 year on in a family hub, for example. And there's a lot a bit further downstream that are really getting to grips with all the evidence-based stuff that we think, oh, parents need to be doing this. Parents need to be making sure they're reading this kind. They're getting children ready for preschool and or nursery school and then primary, etc. All the transitions, and not just reading, but all the Best Start in Life initiatives or parenting programs. We've got good results when we've got people onto these parenting programs. We've got good results when we go onto these parental conflict platforms. But one thing they're lacking is numbers. They're not getting the men that need it on it. They're not getting them to engage. And they're getting relatively few numbers in terms of people on there. So in order to make most use of the things that you've already got going, the real way to open it up is to really make sure dads and men are visible, accepted, and also step up to their responsibility of walking in feeling that they should be doing something. And in order to make those two bits work, we need that ground up approach, and we need a bit of culture and societal shift. And we need to make sure that the advertising and marketing of men being included and involved for the right reasons and knowing the why to is there right at the start. So we have to all get quite good at the marketing of it, because traditionally it's what services and organizations are quite bad at doing. But obviously with reach now, with social media, etc., we can increase and boost that. But actually dads appreciate that face to face, and they will understand the authority of the dads, the health professional, when the dads are entering that space. If they're coming at them with that way, they're looking to speak to them. They're looking to say, welcome, it's great news. You've got a new family on the way. Let's talk about how you can be involved and why. Okay. So I've mentioned where we are. So we're in quite a few places. If any of you from other parts of Scotland want to get in touch, please do. We have our guides, as I mentioned. You'll have seen a lot of them. We partner with you. So if you have initiatives you want highlighted in the DadPad, you can work with us to do that. And wherever you are. In Aisley, we're looking at provision in the south and spreading it. And we have the app, which no doubt you'll have instructions on how to download. Before we go to Q&A and I hand over to Susan, what I'd like to do, if my computer will allow, is just to add two things. If you're ever unsure, or you're going to guide, or you see a dad and you want to get them to the app in North Highlands, there are plenty of posters, stickers, business cards, but there is an app page that they can go to make sure they download the right app and get started. So the dadpad.co.uk/app. And the second thing, if you ever have any questions about us at DadPad, what we do, some of the underlying ethos, if I haven't covered it here, anything around a lot of different things going on in terms of perinatal space, perinatal mental health, including blogs with Scott and others, and North Highlands. Have a look at our blog section on our website. There's going to be a new one soon, but it'll still have all these blogs, and the key content section will take you through everything from why we use the terminology we do, what we're about, and all referenced. So you'll find everything that we've done there. Now, just checking the time, Scott, but I think that's about the 30 minutes.
Yeah,
and so Susan, and I hope that was helpful to you all. But it's just a bit of a take on our journey to the North Highlands from Cornwall, with a stop off in the Midlands where I'm actually was born. Hope to see you all again soon, but I'll be here for the rest of Q&A.
Brilliant. Thanks, Julian. While you stop sharing, and then I make Susan a co-host. I've got one question, Julian, before we open it out to anybody else. There was a very Vogue front cover looking picture of you in a suit holding the DadPad sat on a table, and I want to know why you went past that far too quickly.
Well, neonatal dads are very close to my heart because of people like yourself, Scott, because I think a lot of people know your history. You were a neonatal dad, weren't you?
Yeah.
And it's something I was very proud of. I worked very well with a Dr. Minesh Kashu to build a neonatal DadPad, and it won a BMA award. And it was just a picture of me. Actually, that was a picture of me on a desk, because when we were selling our guides in mother care, I did a load of press photos, and that was one of them. Before I mentioned that mother care then walked off with £9,000 of my stock a month before they liquidated.
So that sole point is why you skated straight past that picture. I get it now. I get it.
It was something of me trying to look formal when I go to a neonatal. I will mention actually that we're going to be a Commonwealth 75 partner. So we're going to Westminster Abbey on the 9th of October, and we'll be in the commemorative book for the Commonwealth 75 nations, and it'll be going all over the world, which means hopefully next year we'll be able to do some work abroad with different nations and talking about the barriers to, and probably getting embedded as a service in different parts of the world, starting with the Commonwealth nation. So it's very important that we try and understand different perspectives. Just like I talked about individuals, every man, woman and child are different. And we need to make sure we have approaches that allow for them to talk about what that difference is, and then be able to understand where they're coming from. Then we can start realistically shifting them in terms of their expectations. Shift them too soon, you overwhelm a man during that perinatal period, is more likely going to stick their head back in the sun. But if you give them clear guide points along, then you're more likely to get the results that you're craving for, really, for that baby and mum and him.
Thanks. Right. So before we've factored in the time, so before we go to Susan, has anybody got any questions that they'd really like to ask Julian before we go to the next presentation? So anybody wants to either raise their hand or just jump in, whatever you're more comfortable with. Go on, see your hand. Yeah, go on, Jane.
Hi there. Do you feel that you're making any inroads with the, like the health profession? Because I'm thinking back to my own experience and like other experiences that I know friends and folk have had, like, when the mother's just about to have a baby and then the midwife goes, nah, it's not happening. And they send the poor dad all the way home, and he's just put the key in the door. Oh, you need to come back, you need to come back, you need to come back. And then bang, he's missed the birth. My own experience was they wanted to send my husband away, and it was my my only child. For me, that was a traumatizing experience because I wanted my husband with me. He was part of his baby. It's his baby and mine, and that's happened to quite a number of people that I've known. So I just wondered if DadPad has been able to highlight these crucial stages, because they're quite quick, as I say, to park the dad home. It's like almost like the old-fashioned thing, the guys sitting out with their wee pipe and slippers and reading the paper. Oh, you've got a baby. Oh, thank you. And I feel that's a crucial part that gets missed as well. you know, for the
I think
bonding and whatever.
absolutely. I'm really sorry to hear about that experience for you. I can understand why we need to make my mission is to make sure that every part of the service, so from the head of the Institute for Health Visiting to the Royal College of Midwives, know about dad's issues and DadPad, which they do, getting that down to the ground and making it really that live, and that having that thought about keeping that man in dad in mind is really important too, is what you're describing. I can only talk about it in terms of had I been there the night that my baby was born. I was there for the birth, but then I had to get out of the hospital. If I'd have been there overnight when Hannah was having a really bad time, I could have been the one who was advocating for her on her behalf. I could have asked for that help, or in fact now with this guide or my app, I could have solved the issue that then came to plague us a while after. So we're really trying to get them to understand those issues, that the gaps, essentially. But the more we get the culture shifted towards the service on the ground, understanding how it's a holistic approach, you know, making sure that the man is aware of what's going on, that there are two chairs in the room waiting for the couple, or there's an absence of bias. It's all we're looking for. It's an absence of it's professional curiosity towards each person, rather than there being just based on potential training that's maybe a bit outmoded or probably structural because of time, and they're leaving it back to how those people were parented. So, but that's why we've written so many articles about it. It's just encouraging people to take more of an interest. If we can get more celebrities or, you know, football teams or people like that to start taking this more seriously. And I think that's our job. We're going to highlight as a service, not us, just all of us, is highlight the pitfalls of carrying on the way we've always done.
Brilliant.
Is putting all the pressure on mums.
Brilliant. Thank you. Thank you for the question. Thanks for the answer. Ivana, you got your hand raised.
Hi, thank you so much. Hi, so I currently work on a needs assessment that is trying to find what the needs of the fathers in the area are. I work for the Health Watch in London, and we are currently conducting a needs assessment. But one of the main things that I'm finding when doing an outreach outside and actually speaking to new and expectant fathers is that a lot of them lack information of what actually happens on the day of the birth as well. And I was wondering if the DadPad was actually ever thinking of producing a little book as well that would maybe consider of what actually happens on a birthday and how father is able to provide his support on that exact day.
So the short answer is yes, we have thought about it. We've actually got the material. Our approach, however, may meet for the men you're meeting potentially may not have been getting a lot of our information, particularly where you are in London, around the -9 months towards the birth in preparation for post-birth, in which case there'll already be a lot thinking about what they need to be doing and perhaps worrying a lot and trying to find support around a lot. So when we did have that information, and we have got pages of it, the difficulty is that there's so much that we could tell them. It's about finding the balance about what they actually need to know on the day, without putting them into a spin and worrying about the whole birthing process. But it is on our radar. But really, what we're trying to do is take the lead from the professionals on the day, and the dad should. So they're welcome to. The dad should be professionalized. But preparing them for post-birth is just as if not more important, when they are at home, when there is no other support there, considering that the mums are not remembering what's going on for post-birth in the antenatal information. And there's a lot to deal with. So we're trying to make sure that the dads don't feel too overwhelmed, but we're going to keep that in mind, because there are some micro things. I know Scott has put some leaflets out there as well. So there's stuff that there is out there. But in terms of help in London, we've just launched in Haringey, and we're going to be launching in Croydon, and I'm speaking to Brent, Tower Hamlets, and Kensington and Chelsea, and quite a lot of the inner city London ones now. So it's something that we'll take under advisement and may check whether they want that information ourselves first, but we might take it from your report once you've got it done, that's what they need. and put something out there. But if you've got my details, perhaps you can we can have a conversation after, and we can look at what that might look like if you want to. It's just hello@thedadpad.co.uk.
Brilliant.
Definitely.
Thank you for the question.
Thank
you, Julian. Right then, Susan, over to you. Thank you very much.
Thank you, Scott. Thank you, Julian. I'm hoping that I can work out how I share this now, as Zoom is not my main platform. Is that working?
Yeah, that's good.
Yeah. So if I do that, does that come up? I can
Yeah,
only see,
just
I can only see my Highland.
on that screen,
Is that
far
it?
left-hand corner, it says play from beginning. Can you see that? If you click that, it will come up.
Okay, it's come up all over my screen at the moment. Is it not on yours?
Yeah, we can see it.
Yeah.
Yeah, we can see it.
Okay, great, thank you. So I'm Susan Ross. I'm the Perinatal Mental Health Advanced Nurse for the Perinatal and Infant Mental Health team in North Highland. Highland, we've got an NHS Highland Health Board, but there's two parts, and that's Argyll and Bute and then in North Highland. And also with me today is Roddy Monroe, who's our perinatal mental health nurse, and Donna Cowan, who is our specialist midwife within the team. So I'm going to talk about a little bit, I suppose, from our journey on supporting dads in the perinatal period. So our team is a relatively new team in that I first came into post in November 2021. I was the first member of the team, so I can still see the day that I was sitting in a room thinking, what am I doing and where am I going? Donna started in January 2022, and then Roddy started in February 2022. It was we had the luxury, and I say it's a luxury because not many teams actually manage to have time to do a lot of networking and kind of building relationships with people, and we had the opportunity to do that. And I think that's where our journey started when we met with Chris at Fathers Network Scotland initially, and Dad's Rock, and we spoke with Mark Williams. So we were kind of starting that journey early on.
Susan, sorry, I've got
Yeah.
to stop you. Donna's just messaged to say that it's come up. She knows this better than we do. It's come up on slide 5 rather than
right.
slide 1.
I think what's happening is we can't see the full screen, but it's stuck on its original screen. We can see that, but when it goes full screen, we can't see that.
Okay.
Hang on.
So if I try again.
From beginning, press that. Click on that.
Yeah.
There we go.
No, I don't
Is that
think
the first one?
No, it's not done it again.
No.
I think it's when you share, you can share the screen or the window, and if you share the screen, it might work.
Okay. Let me stop sharing then. Sorry.
Okay.
It's okay. Don't be. It's your.
Apologies,
Yes.
Susan. I was trying to. I
can't see anything apart from my screen. Okay, so if I share, so I've got the choices of Edge tab, window, or entire screen.
Entire screen, I think. And then when you go full screen on the slideshow, it should work.
So it's only coming up with. I'll try it. Okay, let me see. And then do I put does that work?
Yeah, and then press play from beginning or from beginning.
Has that worked?
Yeah, it's on slide 1 now. It's on slide 1.
Okay. Slide 2?
Yeah, there you go.
Yeah.
Well done, Susan.
Well done. Thank you for guiding me, Connor.
Well done.
If you want full screen, click display settings at the top and then the top option if you want it to be full screen.
It's full screen on me, but
okay. Don't worry then.
We can see it. We can see it,
keep
Susan.
going.
We keep going, it's fine. The
Great,
slides will be
you.
shared as well. Thank you, Susan.
Magic, thank you. Apologies for that. So when the team started, two of our kind of underlying values and principles that we work from is the Women and Families Maternal Mental Health Pledge and the Infant Pledge. And that again is, you know, if you look at one of them, it's my family are given information and support for themselves and to support me, and the infant is looking from the eyes of the infant and who are they seeing round about them, and obviously dad plays an important role and is an important person in that infant's life. So we're obviously very remote and rural. We've got a huge area that we cover, and we're a very, very small team. And like anywhere, there's a lot of challenges that come with that for dads accessing support and services. For us, I suppose there's in some ways a bit more difficulty. We've got probably less services, organisations and professionals that are available. We've got the distance, we've got various job roles that take dads away or they're out long weeks at a time. They can have long days. There's the isolation part of it, that you could be up in the hill in the middle of nowhere. Paternity leave, whether dads are self-employed or whether they're if you're farming or keepering, then that's not going to really kind of work, depending on the time of year. And family support as well, that there may not be kind of strong family support about. And for them to be able to support mums and birthing people, and the stigma that goes around paternal mental health, and I think you find that really it's still quite strong, especially in kind of remote and rural areas as well. So where did we start? So from the outset, we've engaged with health and social care and third sector partners supporting families to ensure that the voice of the lived experience was included in service development. So we've liaised with Mark Williams, Home Start, PEEP and Dad's Rock, as well as Fathers Network Scotland. So we introduced ourselves to Chris of Fathers Network Scotland in December 2021. That's when we had the time to kind of meet people, and we virtually met in January 2022. The team and Argyll and Bute were part of that. Their perinatal mental health advanced nurse came up to Inverness, and we did the Understanding Paternal Mental Health training in August 2022. So we really enjoyed that as a team, and we found it valuable. So we actually then offered training sessions for our wider colleagues. So Chris carried out 2 training sessions, and then we were introduced to Scott, who then carried out another 4 sessions in August and September of 2022, and that was really valuable. And I think that really a lot of the professionals and third sector that signed up for that really found that valuable to kind of hear from Scott and Chris. So I attended a Southeast Perinatal Mental Health Services webinar on the 25th of May 2022. And I have to say, the fact that we can link in with various services and that they're open to other services, and Scotland joining in is really positive. And that's where their webinar was on focusing on fathers and partners, and this is when we heard about DadPad, when Julian spoke at it. Following that, I came off the webinar and I was sitting thinking, why have we not got something like this for dads in Scotland? Nowhere in Scotland had it. I'd asked about, inquired about it. Not many people had actually heard about DadPad. So I then took that back to the team and to our line manager, and we then in August 2022 started having discussions about commissioning DadPad, and then in October we signed the agreement, and we are the first in Scotland to have DadPad available for dads, which I think for Highland sometimes it's thought that we're a bit behind in things and we're not quite up to speed, whereas we can actually now say that we're the first health board to launch this and have dads access it free as well. So we officially launched on the 23rd of April in 2022, and I think the time span between actually the agreement being signed and launching there was a lot of work to be done on just changing links to it being within Scotland and then locally within Highland area as well. So there was a lot of background work that I have to say Hannah was amazing with in helping us and guiding us through that as well. So yeah, it did take time, but we got there, and it was someday when we actually managed to launch it. So then also in September and October and November of 2023, we ran 3 pilot sessions of the Figuring Out Fatherhood, which were well attended, and Fathers Network Scotland got excellent feedback on that, and that was with Scott. And again, they're brilliant sessions. I love doing these sessions with Scott, and Roddy's been along to them as well. And I think what I get out of it is it's quite relaxed for dads. It's nice and informal. There's lots of information that they have, and time for them to kind of ask questions and just take away and kind of reflect on things as well. And I think from that, in the sessions, they talk about, Scott talks about DadPad, and to say that actually you can now download it and have access to it is a great thing for Highland. So going forward into this year, we've got another, we've held one further Figuring Out Fatherhood session, and we've got another planned for October, and we've got an Understanding Paternal Mental Health training session planned for October as well. And our PEEP colleagues also have now taken DadPad books into HMP Inverness for dads to be able to access, or dads to be able to access as well, which is really good. So this was our launch. We had a beautiful cake made by Harry Gowes with our colours and DadPad colours. We had Mark Ridgers, who was then the Inverness Cali Thistle goalkeeper, attend, and he used the DadPad. We had a pre-launch event at one of the Inverness Cali Thistle games, which was quite interesting because everyone kind of body swerved us to begin with, but then eventually once one or two dads or granddads came up and spoke to us, then people were a bit more relaxed about coming to speak to us. So that was quite exciting. And then our DadPad banner has now been doing its rounds round Highland and to different maternity services to kind of promote that. And I think as a team, it's about continuing with that promotion and to keep, because there's obviously new professionals coming in, there's new services starting up. So it's just to kind of keep that enthusiasm and passion for it going, and that dads can access as well. So we recognise that there's a lot to still do. There's a lot of awareness to still raise. There's a lot of relationships and partnerships to keep going and to continue developing. And I think it's recognising with the Fathers Network Scotland survey, the 2023 survey, and what came out of that, and then the Paternal Perinatal Mental Health Evidence Review, which came out in January 2024. Looking at these and the ongoing research and articles, and literature that's evidencing this, and how we can best develop that. I think locally, how we can change practice, how we can take things forward as a team, the training that we can deliver, and also in partnership deliver on dads and partners' mental health. And to kind of keep that momentum going and supporting that alongside everything else that we do with the mums, but that kind of wider service development. I don't know if any of my colleagues, Donna or Roddy, want to chip in with anything before we finish.
Yeah, I would, Susan. Thank you, Susan. Yeah, I mean, it's been great working with DadPad and Fathers Network Scotland, and for me, DadPad coming to North Highlands has been wonderful. Really, I think from a professional and a sort of personal perspective, I think coming so professionally, obviously, I'm a perinatal mental health nurse, work within the team with Susan and Donna, and I suppose there's strong evidence out there that working with the mums that we see, that if dads are empowered, have all the information, keep well themselves, then there's a better chance that mums will keep well and recover. So professionally, it's so valuable. And I suppose personally as well, I am a Highlander. I'm from the Highlands. I've been here all my life. I'm a dad. I've got 2 girls, and I remember even personally difficulties I had as a dad when my kids were. I remember my youngest one, when she was born, she had some problems afterwards, and she had fever, and she was quite unwell. And I just remember colleagues saying, "Oh, did you not know things like that could happen? You're a nurse." No, I didn't know that. I didn't know things could happen like that. So, and I think as well in Highlands, I think in Scotland, I think males are generally very quiet, subdued, keep things to themselves probably more than males in other countries, other parts of the country. And I think that kind of Highland way is to keep quiet, keep things to yourself, particularly for males and dads. So I think this kind of the DadPad, the access to the app is just kind of breaks down those barriers and supports dads in Highland. So so yeah, I'm really enjoying working with DadPad, and really intrigued and curious to see where it goes. So thank you.
Sorry, I've got a wee question for everybody, really, everybody combined. I'm going down the old cliche thing. See, like the DadPad and even like the maternity services in general, right? Don't laugh, but I'm just wondering, what about like taking something like that into like the high schools? I know they do biology and they do personal and social sort of things, but and I think they used to give out a doll, a baby doll, to girls or something like that. Now it was I'm probably like 19 canteen, but is there any sort of way of thinking like of reaching out to, you know, even earlier? Like I mean like 5th year, 6th year sort of groups. Do you know what I mean? Because quite often, you know, there's lots of like young people pregnancies and they don't know. Like some of them are still children, you know, and I just wondered about that sort of thing. I feel like I want to shout DadPad and the work of my Highland friends here from the rooftops, you know, because it should be out there. This should be something that should be compulsory. It shouldn't even, you know, it's really inspiring and empowering. But I keep thinking about young people. You know, some people are 16 because I work with care experienced young people, and you know they're just still so young. Some of them are going to become dads for the first time, and some of them are mums too. You know, it's a wee combination. But I just thought about that. That's me.
Thank you. No, thank you, Jane. I seen Julian's hand go up really quick for that one. So
really
go on,
quickly.
Julian.
Now, someone else might want to give a different answer after this. So, Jane, I absolutely admire the thought that we should be able to get this in PHSE lessons, put it in school, and that would help us on this journey. Now, the evidence for adding modules around parenting in school is almost non-existent. There are some. There's one apparently done in another country miles away where there was some advantageous use of sticking it in. Now, the problem I've asserted, and this may not be correct because the research hasn't been done, but when I talk about that starting gun, that stopwatch starting, when they realize they're going to be a father, that is the starting gun. And that's why we're in such a precarious position, because you've only got from then onwards. And the reason I say that was because I think there's a difficulty in trying to teach it to young children, and their children, you know, 15, 16, 17, their children, front brain, back brain, they're not thinking about perspective, and that's even into their 20s, but they get better at it. Now, giving them something to try and put themselves into someone else's shoes in during the school time is, very admirable. In the UK, so in England, when they introduced those dolls, the baby dolls to young mums, they were not young mums, to young college goers. They actually, the teenage pregnancy rate went up because they were seeing themselves with a baby and they were taken away. And there's a maturity understanding here, which is why, and that needs examination. How do we? Now, there's a lot of good things going on at schools from very early. I'm a governor at nursery school and have been for 10 years, really well run, that links into transitions for year one at primary school and then onwards. So we see them come through from the early years, and the bits that they're doing really well are around, sharing and talking with other people from all different parts of society with different thoughts and backgrounds, and those kinds of skills they're learning. But the things when it becomes very particular to themselves and they realize they're going to be a father or mother, the father, that's when it starts in particular. So when they see the line, that is a real wake up. That's the bit where it becomes real. How can you prepare for that? And that's the question. How can you prepare for that? And I'd be more than willing to go into every school in the country and start talking about having a look at this is going to help you get your mindset prepared. And I'm quite willing to hand it openly over to any government program that would open its doors. But there's a whole shift in society that needs to be happening. It's coming. It's probably here anyway, because mums turn to their dads and go, why aren't you an equal part now? They know you need to be more of an equal partner because I can't deal with it all on my own. I can't deal with the next 30 years of life bringing up these kids on my own. And you're insisting I do that because you're not able to do it. Certainly they won't look back with favour in that. So that's why we need these men included and supported. So that's my 10 pence worth around that. So I'm sure there are educational programmes that need to be looked at much further in schools.
Okay, brilliant. Thank you both very much. Ivana, you have your hand up.
Hi, well, I just want to add on that. Tava recently read a study that was done in Australia where they created an NCT classes that were specifically designed for dads. So it wasn't parenting classes for parents, but they were NCT classes for dads specifically. And that this kind of helped it capture their attention and their knowledge a little bit better because a lot of the classes, even though NCT classes are amazing, they're so educational, most of it is always focusing on how do you make sure that the mother feels good. So with this kind of thing, they were able to, adjust the language and adjust the actual delivery of the classes specifically to fathers. Thank you.
No, brilliant. Thank you for sharing that. Darren, your hand's up, mate.
Yep. How are you? Sorry, just another wee question. I work for Local Sure Start, Northern Ireland, oversee the dads work here. We buy in the DadPads and dish them out to any new dads or dads to be. But obviously the issue is I can have such a small impact with the dads that I'm able to reach. I have spoke to perinatal teams who seemed interested. I went to their team meetings. I went to a couple of regional workshops, spoke to them about the work we're doing, but then it kind of seems to be forgotten about. So what else can I do to, encourage them to become more dad focused?
I mean, from my perspective, if I didn't see anyone else's hand up, but from my perspective, as someone who's grown this from the ground up, from the start, it is persistence, patience, finding the right people, maybe getting a case study, asking Susan, Donna, other commissioners or other DadPad areas that I've got to give you some feedback to take to your circulatory boards that you have in Northern Ireland. I can come and sit in with you to some of the meetings, talk about what's going on in the UK, and we can push it forward from there, help you find funding, those kinds of things to grow to the size and scale that you want to grow, Darren. But that's just it just takes time. It is sad that I think there's another marker that proportionately we don't want to take any money from women and girls because it's absolutely needed. But what we've got to get systems to understand is by just investing a proportion of money to the men in their lives or the partners in their lives is going to reinforce that spend on mums, and in fact make sure that spend on mums isn't wasted, because the men can drop a lot of issues into that family that cause a lot of issues for funding issues for the whole family and society. All we're talking about is some preventative money. So we get such a small amount, proportion to the work that we do. And how many dad and male advocates are there for male voices as new dads in this country. There aren't that many. I know most of them. You see some are really good at PR, some aren't. Some are good, some aren't. Some of them just want to do the work, Darren, like you and I, just want to get on and work with those people. But we've got to get better at the other stuff too. And I wish there was more funding out there to support us. So anything I can do to help, you can always email me. We can try and get to speak to someone at a bit higher level. But we can also utilise some of the other commissioners around the country to say, we need to move things forward here in Northern Ireland.
Yeah, well, our perinatal teams are like so new within all the trusts within Northern Ireland, with like the last year maybe, and there's probably not enough funding and resources to deal with the mums, so the dads are not considered at all. I get the odd occasional one signposted to me, but there's only so much I can do as a single person.
I'm sure we can talk about that off call, about how we can grow that. Yep. If they're new on the ground, it's probably a good time to start the conversation and make sure you don't leave that conversation over.
Yeah. Okay. Perfect.
Definitely brilliant. Thank you very much, Neil.
Hi, sorry. Just to sort of piggyback on that there that was just said, I'd be quite interested in joining in with those conversations. I work in, I've just started at Home Start Caithness in Wick, and will be doing dads groups, but it's not something I have any experience of. I'd be interested to know who are the best people to talk to, just to get an idea of how I get this up and running in a way that's sort of effective and visible. But I don't think this is maybe the right forum to do that.
No, that's fine. I'll drop you an email and I'll compile a list of the people that would probably be helpful.
Cool. I was given your name actually, Scott, by my colleague Moira Smith. So she told me you would be the man to speak to. So she was definitely correct. Thank you.
No, thank you. Okay. Brilliant. Thank you. Anybody got any more questions for either of the speakers before we start to wrap up? Anything they want to ask?
Sorry, can I just say to Neil that we're happy to chat with you, Neil, as well, from the team perspective, and PEEP also have dad groups and things that are running quite successfully in Inverness as well, so we're more than happy. I can give you my email, I'll stick it in the chat box.
Brilliant. I've actually had a message come through, Julian, and it is how people that don't have DadPad in the area, from a commissioning point of view, how do they go about bringing it? What's the process look like?
They just need to book a call with myself. I'll go through the package like they have in North Highlands and Argyll and Bute, give them a cost and a quote, and from then on, it may take a little time, between 2 and 6 months, to kind of get it up and running. But that's about making sure it's absolutely right from the start. Okay. And I'm then on hand to do workshops and talk to all the rest of the teams once it's been agreed, and do some workshop training, etc. And I'm sure they can always speak to Susan and Donna about the process if they if I struggle to explain it properly at your side of what it takes, because our side is relatively streamlined, so we can get it up and running